Hi everyone, my name is Carla Solorzano, and today I will be talking about the opioid epidemic that we are currently facing. The opioid epidemic, also referred to as the opioid crisis, is the rapid increase in the overuse, misuse, abuse, and overdose deaths attributed either in part or in whole to the class of drugs called opiates since the 1990s. The opioid epidemic has become synonymous with the tragic surge in overdose deaths, highlighting the urgent need for intervention. Overdose deaths, stemming from the misuse of prescription painkillers, heroin, and synthetic opioids like fentanyl, have skyrocketed in the recent years, exacting a devastating toll on individuals, families, and communities. The opioid epidemic has significantly increased since the American Pain Society's efforts in the mid to late 1990s recognized pain as a fifth vital sign. Opioids began to be more accessible since cancer patients or patients with chronic conditions were in desperate need of them. But what pharmaceuticals and providers didn't have in mind was that opioids would be misused, leading to dependence, addiction, and even more severely, overdose. The nurse's duty and the provider's duty is to assess the onset, provocation, quality, radiation, severity, and the time since the pain has started. They use a numeric rating scale of 0 through 10 to rate the severity of the pain. 0 means no pain, and 10 means the worst possible pain. And based on the number on which the client rates his or her pain, providers will prescribe a specific medication to treat the pain. From 0 to 5, providers usually prescribe acetaminophen or ibuprofen. From 6 to 10, providers usually prescribe a narcotic such as hydrocodone, oxymorphone, or morphine. A disadvantage to this is, since pain is considered a subjective assessment and subjective observation, nurses and providers are obligated to treat the pain without necessarily further questioning if the pain is real or not. Now let's talk about the difference between opioid misuse and opioid addiction. Opioids are one of the most powerful and effective painkillers, and this is why they are the most addictive. Physical dependence manifests with the emergence of withdrawal symptoms when the use of opioids is abruptly discontinued or even when they are tapered down. Some of the symptoms include nausea, vomiting, diarrhea, irritability, anxiety, and insomnia. And this is why individuals tend to seek more opioids to avoid all of these withdrawal symptoms. Also, opioids increase the release of a neurotransmitter that we naturally produce called dopamine. And it is often referred to as the feel-good hormone since it contributes to and enhances feelings of pleasure and satisfaction. When opioids are misused for their rewarding effects, prescription opioids are frequently snorted or injected. And since they are snorted or injected, they lead to a faster uptake in the brain, enhancing their rewarding effects, increasing the misuse and dependency. Repeated drug exposures conditions individuals to become accustomed to the rewarding effects, as well as to their withdrawal symptoms. Repeated drug exposures also disrupt the prefrontal cortex of the brain, which then leads to characteristics of addiction such as impulsiveness. Now I would like to address the immediate solutions. Addressing the complex issue of opioid misuse demands a multifaceted approach that requires prevention, treatment, and social support. Prevention efforts should focus on education and awareness campaigns aimed to both patients and healthcare providers, or the healthcare system in general, regarding the risks of opioid use and alternatives for pain management. Also, if you're taking painkillers that are narcotics, that are opioids, you should know what you're taking. Know what you have, know the mechanism of action, know the side effects, know how to safely take it. Most of the time, these opioids are prescribed as a PRN, and PRN basically means that you need to take it as needed. This is not a scheduled dose. It's not something you need to take every day, every 8 hours. No, these are taken as needed. And a lot of people don't understand that. Opioids should also be stored securely. They should never be shared. And if you find that you no longer need them, you can go to the nearest pharmacy and turn them in so the pharmacy can safely waste them. When the opioid epidemic started in the 1990s, the FDA immediately approved methadone as the medication of choice for medication-assisted treatments to treat opioid use disorder. Prevention efforts must also focus on the access to evidence-based treatment options, including medication-assisted therapies and mental health support, which are critical for those struggling with opioid addiction. Like I said, methadone is used to manage addiction and reduce the likelihood of overdose by acting as an opioid agonist. Methadone stabilizes patients, reduces opioid cravings, and maintains a steady state. If a patient or an individual is in a steady state, patients' mental health will improve, making them more likely to participate in counseling, therapy, and other support programs that will address the problem. The objectives of long-term management include reduced risk of death and disease, and improvement in mental health and outlook. Finally, promoting a supportive environment within communities in the healthcare system through stigma reduction and increased access to social services can facilitate long-term recovery and reduce the impact of opioid misuse on individuals. It is important to note that the stigma associated with the opioid use disorder does not exist in isolation, but intersects with and is compounded by marginalization linked to race, gender, ethnicity, socioeconomic status, sexual orientation, and age. The opioid epidemic represents one of the most pressing public health crises in our time, characterized by widespread addiction, devastating loss of life, and significant social and economic costs. Addressing the crisis requires a multifaceted approach. By implementing the comprehensive strategies that I have just shared with you guys, there is hope for mitigating the opioid crisis and improving outcomes for affected individuals and communities. And by doing so, lives can be saved, communities can be restored, and they can promote a healthier, more resilient future. I hope that you guys found my research project helpful, and I really hope that you guys can go out there and spread the word to the community. Thank you guys. Bye.